On January 21, 2020, the United States recorded its first case of COVID-19. Just days later, we saw the first case of community spread. Essential hospitals have been on the front lines ever since those fateful events. Essential hospitals are no strangers to providing care when it's needed most. They form the bedrock of our nation's emergency response. But this public health crisis is different, not only for essential hospitals, but for the low-income patients, communities of color, and other vulnerable people they serve. COVID-19 takes a disproportionate toll on these populations. Social and economic barriers, systemic racism, and other inequities lead to persistent disparities in healthcare and healthcare access. Essential hospitals patients are at the center of that storm. Despite the challenges of a devastating pandemic, our hospitals have stepped up with a boundless determination to make the most of limited resources, provide the best care possible, and cultivate hope during our most trying times. From testing to triage to treatment, essential hospitals have expanded capacity and employed innovative and novel approaches to patient care. UW Medicine in Seattle was one of the first U.S. health systems to respond to the pandemic. UW launched drive-through and at-home testing, set up a dedicated COVID-19 intensive care unit, and created an outdoor emergency triage site, setting the stage for Essential Hospitals' response to come. Essential Hospitals anchor communities with life-saving care in COVID-19 hotspots across the country. In New York City, NYC Health and Hospitals responded to surging patient counts and staffing shortages with a new system to quickly recruit and onboard 3,700 volunteers from around the country. The patient surge was so great in New York City that SUNY Downstate Medical Center, another essential hospital, transitioned to COVID-only status. Both played an important role in the success New York City has seen with the pandemic. Essential hospitals have responded to the disparities inflamed by this pandemic by linking patients in need to housing, food, and other basic needs. Essential hospital leaders from University of California San Francisco Health and Zuckerberg San Francisco General Hospital and Trauma Center created homelessness screening protocols used statewide to coordinate care between hospitals and local housing services. They also forged partnerships to secure housing for infected patients that do not require hospitalization. Across the country in Cambridge, Massachusetts, Cambridge Health Alliance works with community partners to mitigate food insecurity through a free, socially distant mobile market. As they reach outside their walls to safeguard the community, essential hospitals also look inward to care for their frontline caregivers and meet their physical and mental health needs. For example, leaders at ChristianaCare in Wilmington, Delaware, round with a well-being wagon stocked with practical needs, such as food and lotion. These check-ins open up conversations about mental health and other available resources. Much has been uncertain during the COVID-19 pandemic, but we know one thing for sure: essential hospitals are invaluable to the communities and people they serve. From expanding capacity to confronting disparities, essential hospitals have stayed true to their mission of caring for the vulnerable. And we couldn't thank you enough.